Hello and welcome. My name is Dr. Shadi Tabai, and in today's video, I'm going to show you how endometriosis is diagnosed. Endometriosis is a condition where the uterine lining ends up growing outside of the uterine cavity, and this can cause a lot of inflammation and a lot of pain. On average, it takes about 8 to 10 years to diagnose someone with endometriosis because the gold standard for diagnosis is a surgery called laparoscopy. In a laparoscopy, we actually surgically go in, search out for lesions, and if there are any, we take it for biopsy. Even though it will give us a definitive diagnosis of endometriosis, it's not often used unless the woman has severe levels of pain and is not responding to conventional pain medications. There are some non-surgical options we can look at in terms of diagnosing endometriosis, and I want to talk about a few of them. Number one is symptoms. This is huge. Women with endometriosis often have a lot of pain. They'll have pain while they're having their period, pain outside of the period, pain when they have a bowel movement, pain when they're urinating, pain when they're having sex, just pain, pelvic pain overall. Depending on where the lesions are growing and to what extent, that can change the level of pain and where the patient actually feels the pain. But the pain is different from typical PMS pain because it's very significant, it often needs to be overly medicated, and it doesn't stop after bleeding is over. It tends to continue, especially during ovulation. So anytime women are having significant levels of pain, especially with their cycles, we tend to think it may be endometriosis. The second way we can help diagnose it is to use a blood test called CA-125. This marker will help us to rule in endometriosis, but it doesn't help us to rule it out. Meaning, if you get a positive CA-125, so anything over 35 units per milliliter, we can confidently help rule in endometriosis if you have other symptoms. But if your CA-125 is low and normal, that doesn't mean that you don't have endometriosis. So a positive result can help rule it in, but if it's not positive, we can't rule it out. The third way we can help to diagnose endometriosis is by using imaging. Things like MRIs, ultrasounds, CT scans. These can show lesions in the pelvic area. So these three things together, the signs and symptoms, the CA-125 antigen, and any imaging done can help us move towards a diagnosis of endometriosis. So let me know in the comment section if you've been diagnosed with endometriosis and what criteria they ended up using to help diagnose this. And if you haven't already, check out my video where I talk about 3 natural medicines that can help to improve endometriosis pain, reduce the size of the lesions, and improve fertility potential. I'll see you in the next video.